Today we are going to be talking about men's health, and we want to narrow it down to one major issue that affects men, and that is the prostate health. I want to talk a little about the prostate. The prostate gland is the size of a walnut located between the urinary bladder and the penis. So this gland is very fundamental to a man's health. The prostate gland makes what we call secretions that help to carry and accompany the sperm cells, alright, during ejaculation. When a man ejaculates, which is a white or milky liquid, contains the sperm cells and a lot of secretions coming majorly from the prostate gland. So the prostate gland makes about 80% of the secretions that a man produces during ejaculation. Now, the prostate gland is a major fertility organ for a man because the secretions, or what we call the prostatic secretions, help to nourish the sperm cells and as well as improve the motility of the sperm cells. So a man who doesn't have a healthy prostate may not be fertile. Okay, all right. Now we have come to understand that as a man grows older and older, some diseases begin to develop within the prostate. There are several types of diseases that may develop within the prostate, but I'm going to narrow it down to just three main prostate disorders. The first is what we call prostatitis. Prostatitis is an inflammation of the prostate gland. Okay, it can be caused by microorganisms, and then that can lead to the swelling of the prostate. We have another one we call benign prostatic hyperplasia, or BPH. BPH is an enlargement of the prostate gland that occurs with age. BPH is not cancer, but it can cause enlargements of the prostate gland. Now, finally, we have the one we call prostate cancer. Prostate cancer is a malignant tumor developing within the prostate gland. Now, these three major prostate disorders can manifest in a similar manner, and there are several symptoms that a man will begin to see, and he is going to be worried about his prostate. The first is that because of the location of the prostate gland, it is located in a region where the urethra passes through. The urethra is the pipe connecting the urinary bladder to the exterior. So the urethra, which is a pipe, passes through the center of the prostate gland. Now, the fact that the urethra passes through the center of the prostate gland makes it that any disease that begins to develop within the prostate gland will manifest in changes in the way a man urinates. All right. So when a man begins to see some changes in the way he urinates, he may begin to get worried about his prostate gland. Now, there are several symptoms, but I'm going to give us just a handful of them. First of all, a man may begin to have difficulty urinating. Difficulty urinating is a sign, can be a sign of prostate disorder, right? Now, some men can have what we call urgency. Urgency means that if you want to urinate right now and you are asked to wait, like if you have the urge to urinate and you are asked to wait, you cannot wait. You can even wee on your body. Some men can have what we call straining. Straining means that if they want to urinate, they have to apply a lot of pressure for urine to be able to come out because the outflow tract is kind of narrowed. All right, some other men can have what we call frequency. Frequency means urinating at every interval, every short period of time they want to urinate. Okay, some men can have what we call nocturia. Nocturia means waking up at night several times to urinate. Okay, there can be other symptoms like blood in the urine or even what we call urinary incontinence. A lot of men can also have urine retention, like they go to urinate and they find out that after urinating there is still urine within the bladder. That is called retention. Now, there are so many symptoms that men can have, and they will know that they have prostate disease. There are tests you may need to do to find out what kind of prostate disease you have. Is it a prostatitis, or is it a benign enlargement of the prostate gland, or is it a prostate cancer? According to studies, we have found out that after the age of 40, the prostate gland begins to enlarge, gradually. This gradual enlargement may just be an ordinary enlargement of the prostate gland that we call BPH, or it may be a cancerous, development within the prostate gland. There are tests that need to be done to find out whether it is a cancer or not a cancer. Of course, some simple tests like the one we call PSA, prostate-specific antigen, can be done. Once the value is within the normal range between 0 to 4, that is okay. If it's more than 4, it could be a pointer to an ordinary enlargement or If the value is so high, it can be a pointer to prostate cancer. There are other tests that can be done, like what we call ultrasound scan, prostate scan, and then even some examination of the prostate gland can be done, what we call DRE. There are good news and bad news. Now, the good news is that there are things a man can do in his lifestyle that can help him to evade a prostate disease. But the bad news is that if every man will live long enough, every man will develop prostate disease. These guidelines that can help a man to stay healthy and avoid or prevent prostate diseases include things like, number one, we have advised men to stop wearing a lot of tight underwears. Tight underwears are not very good for men. We have also advised men to ensure that they eat enough vegetables and fruits. According to studies, if men don't eat vegetables and fruits, they quadruple their risk of having prostate disorder. Now, we have also found out that things like nuts, like pumpkin seeds, the cashew nuts contain a lot of zinc, and the zinc is a mineral that is very, very essential for healthy functioning of the prostate. We have also found out that regular intake of red meat can triple the risk of prostate disease. We have also found out that a lot of dairy products, daily consumption of a lot of dairy products can also increase the risk of having a prostate disorder. And we also found out that tomatoes have what we call lycopene, and the lycopene is very healthy for the prostate. So we advise that men can eat fresh tomatoes, or if they are making tomato stew, the tomato stew shouldn't be boiled for too long. Just 15 minutes is enough, and you can have a healthy stew for the man. Apart from all these things, we also advise healthy nutrition, general nutrition, exercise, and then for a man to also ensure that he has the adequate health supplementation, or use what we call natural health products that can assist with maintaining healthy prostate. In Fafo Life as a company, we have wonderful products like Salute. 30 to 40 meals of Salute morning and night can go a long way in helping a man with the prostate. Now, we have a Faforon. Faforon is also very good for men that have prostate disorders. And then we have the one we call Prostate. Prostate is a capsule that is specially made and formulated to assist men with prostate disorders. 2 capsules of Prostate morning and night will also go a long way. And we have Spiders 19, amazing products. Spiders 19 is very important for men that have prostate disease because Spiders 19 has natural antibiotic effects, and men that have prostate disease are usually prone to urinary tract infections. Using these products can help our men not only to stay healthy, but to have amazing and wonderful prostate function. Thank you so much for joining us today. We love our men. Watch out for our next episode coming up next week Monday. It's also going to be amazing, informative, and very, very entertaining. Thank you so much.